enter the room.
Hello, examiner. My GSC number is 0000. Hello.
Hi,
How are
doctor.
you?
I'm good, doctor.
Okay. Hello, how are you? My name is My name is Dr. Patience Kachamtima. I'm one of the foundation year 2 doctors in this emergency department. May I please confirm your full name before we proceed?
Yeah, sure. I'm Dale Morton.
Okay, nice to meet you, Dale Morton. How old are you?
Um, I'm 22, I guess.
All
23.
right. Okay. Oh yeah. Well, I've just realized, yeah, you're a third year medical student, and I'm supposed to be teaching you today about how to do subcutaneous injections.
Yeah, yeah.
Oh, okay, yeah. It's all right. I'll take you through it. By the end of the session, you should be comfortable with it. So let me know, are you okay with me calling you Dell through this session?
Sure, Dale works.
All right. So Dal, tell me, maybe I can just do an assessment of your basic, okay, your understanding of subcutaneous injections before we start. What is it that you know about subcutaneous injections?
I don't really know much about it. I've just seen it, been given for patients, especially in the ward. I've seen it being administered for heparin. I just wanted to know, what are the different kinds of uses of it, and hopefully to master it, so that I can use it later in my career.
Okay, oh, that's good. So if I understood you well, you just have basic knowledge, you've seen it being conducted, and you're keen on understanding how to the uses and how to use it. Yeah.
Yeah, yeah.
Okay, that should be okay. We should get on to it. So we use subcutaneous injections for a variety of things. Like you've mentioned, you've seen heparin being administered using a subcutaneous, with an injection. So basically, there are many routes to administer medications via the skin, like doing injections. And subcutaneous is one of the methods where you are you're administering the medication into the skin, but not deep enough into the muscle, just into the subcutaneous layer of the skin. Do you understand that?
Yeah, sure. I mean, but why this layer? What is the importance of this layer?
Sorry?
Why do we administer it to this layer? What is the importance of this layer?
The importance is that there are certain type of medications that absorb very fast in the subcutaneous layer of the skin. There are particular type of medications you'd want to put into the skin direct, not into the muscle. They're rapidly absorbed there. Most of these medications are usually lipid soluble medication.
Okay, okay.
I hope
And
I've answered you. Have you
like,
understood?
yeah, yeah. And what are the common sites where you would, give this injection?
There are a number of places people really prefer. Well, the subcutaneous is throughout the body, obviously, where there is skin, but people usually prefer the lower abdomen area. That's where most people prefer. They say it's less painful. Or inner thigh. Inner thigh is also a good site. Or it could be the arm. The arm also, you could also do a subcutaneous there. Those are the three most common sites you could use.
I see. All right.
Yeah. So, do you have any question? Yeah, feel free to intercept and ask questions as we go through.
Sure, doctor. I'll do that.
Yeah. So there are a number of medications that we put through subcutaneous routes. Insulin being the most famous one, where the doctor can do it, or most cases have taught patients to do it at home. So the medication like insulin and that's the most common one you see. And also when we in the ward we want to put different type of drugs, we can also use the subcutaneous route. So the way you do the procedure now, I'll just show you how you do it. Unfortunately today I won't you won't be doing it. You'll just see me probably doing it and demonstrating it. I hope that's okay.
Sure. Yeah.
All right. So like any procedure, you need to you need to you talk to the patient. When you see the patient, you confirm, you create your rapport, you greet them, you introduce who you are, and after doing that, you confirm their name, their age, or if it's a patient that's not responsive or non-verbal, you can confirm with their what do you call it, their band, their hospital band, and make sure the details they match, because you don't want to be administering medication in the wrong person. I hope that's clear.
Right, right, yeah.
Yeah. And so like any medical procedure we do, it really has
2
to
minutes
be
remaining.
a sterile procedure. So the whole thing is you explain to the patient what you're going to do. I'm going to administer medication into your skin, obviously using non-medical terms most of the times, into your skin. And this shouldn't be painful, because it's not supposed to be painful, but you should just warn them that it could be a sharp scratch. And when we do that, obviously we've ruled out risk factors for people who have like bleeding disorders. You have to be sure that the person you're going to be administering such medication doesn't have bleeding disorders, doesn't have allergies to the medication you're also giving. And yeah, you
Mm-hmm.
move on from there. So after that, before you put the medication, the subcutaneous injection, make sure to clean the area. You clean the area. After cleaning the area, you can inject the medication. So the way you do it, it's supposed to be at 45 degrees angle to the skin making the planar, what you call it, the planar area. It's like your 0 degrees, and the injection should be injected at 45 degrees angle, and then you inject your medication. After that, like any medication, you pull out, you put your sterile cloth or your cotton, and then you seal it, you seal the area, and that's it. You dispose your needle into the sharp scan, and that's it. Do you have any questions so far?
No, I've seen that sometimes they don't give it in the same place, they keep changing the places. I mean, is
Yeah,
that
you should. Yeah, that's right. Yeah, that's an important observation. You should do that, because with continuous injections, the adiposity, the fat in that area keeps reducing. So you need to change
Move on
size.
to the next station.
all
Thank
right?
you.
Patience, good job. That was good. That was good. All right, let's talk about teaching stations. As you guys all know, that's a teaching station. And the important things when it comes to teaching stations are that you know most of the times it needs to be interactive. All right, so you're definitely asking them, "Are you with me? Did you understand what I just explained to you? Do you have any questions?" Those are good, but also, were you able to gauge how much the student understood? You need to manage to keep their attention. So what is a good technique to gauge if the student just understood what you just explained? Dr. Patience, or anybody who wants to answer, what is a very good technique?
Well, I would assume it's asking for feedback. Like, did you understand? Or you can ask them to just give you a summary of what you said.
Absolutely. I mean, ask them, quiz them on what you just explained. We just spoke about the different medications that are given for so I was given as subcutaneous injections. Can you list a few for me? You know, so just quiz them on what you just spoke about, right? So that's how you get their attention. So by doing that, you can actually understand if they've understood it correctly or if they've had any misconceptions or they've understood it improperly, right? So most of the times, the simulator they will give you the wrong answer to the questions that you ask. All right, so the examiner wants to test how you approach any incorrect answers. How would you rephrase it to them? How would you paraphrase it to them? How do you, how do you explain the whole thing again if such a thing happens? All right, so this is a very important technique to be used in teaching. Always check for understanding. And if they do make a mistake, you know, repeat what you have said again, maybe in a different way, or emphasizing on the information that you wanted them to understand better, right? So definitely keep doing that. At least check understanding thrice throughout the entire consultation to make sure that, they are on the same page as you. Just asking the fact that you are on the same page is not enough, you know. So it needs to be interactive where you understand that the student is also interacting with you. All right. So since this is a student, and I think it took you a little bit of a time to understand a little bit about, the patient itself or the student or the colleague. So whenever you're talking to a colleague, start with like, little small talk initially, just keep it light, just ask them how their rotation is going. Just ask one or two questions around, their interest in the department, what their rotation is and all that, before you jump into the topic. So when you're talking about the topic, it's important to ask why they want to know, what they already know, and what would they like to cover, so that you can make like an initial plan, a plan of what you want to talk about. So even before you start talking about the teaching procedure or teaching thing, or the teaching topic itself, give a little bit of an overview of what all you're going to talk about. Because most of the times in these stations, you might not be able to complete these stations because it's going to be an interaction. But give a little overview, mentioning that, since subcutaneous injections is something that you'd like to talk about, we'll talk about what a subcutaneous injections is, all the preparation that is needed for it, that is pre-procedure, how do you do the procedure, and some post-procedure, things that we need to make sure to carry out. Right. So you're kind of giving like, just in case if you're not able to cover those areas, the examiner kind of knows that you're going to talk about all these things. Right. So you're kind of telling the examiner that, yes, I have it in my plan to be talking about so and so aspect about this particular topic. Right. And this overview needs to come from what this student has asked for. What is it specifically that he wants to learn? Right. So make the overview around that aspect. All right. And one important thing is, always safety net and follow up. How would you safety net and follow up in a teaching scenario like this? Just in case we are unable to, finish this topic, or, due to some reason I'm called away. Or if you have any further doubts, please feel free to contact me. I'm going to share my personal cell number, so that you can reach out to me anytime and we can arrange another session sometime in the future. Right. So that's basically your safety netting and follow up. And one more aspect that you can add is leaflets. So you can actually direct them to any credible NHS site that could give them a better idea of subcutaneous injections. Right. That way, they're like, I'm going to give you some resources that you can read up about, this topic. That way, you'll be very clear about, different aspects of this topic. So make sure to do all these three things for management itself. That's also very important, right? All right, let's quickly look at the score. Now, one second, I'll just pull up. One moment. All right, got it. All right, so this is all right. So this is the sheet where we will be discussing on all the points that were covered and were missed on the different domains. So data gathering, confirm that he is in, third year. Like, oh, hi Dale. From so aren't you Dale Martin? Aren't you from third year? currently? Are you in third year currently? Just a few questions, informally to ask in which year and what's his name, right? Initiate light conversation to build rapport and reduce tension. How's your rotation going? Something along those lines, right? Gauge understanding. So this is also important as you do, as you conduct your teaching sessions, to do throughout the session itself, right? What do you know? Oh, this is before you actually start with your topic. That is, gauge the understanding of what he already has, right? What do you know of subcutaneous injection so far? Explore the student's current understanding and the technique and its purpose, right? Ask why the student wants to learn this skill and how it fits into his current goals, right? Ask if the student has ever seen or assisted a subcutaneous injection before, right? Ask Dale to summarize key points at intervals to gauge understanding. So this is very important. Check comprehension. Periodically ask the student to summarize or repeat important points. Use open-ended questions to assess the depth of their knowledge. Can you tell me what you know about the common injection sites, right? Along those lines. Correct any misunderstanding immediately. So if you've understood that they're giving you the wrong answer, don't move on with your conversation. You have to make sure that you correct any misunderstandings that you have seen that they're making, right? All right. And then management, set the learning agenda, explain what you will go through today, such as preparation, technique, safety, and precautions, right? Set the scene. Today we'll go through the steps of performing a subcutaneous injection. If you have any questions, feel free to ask, and ready to start. Explain the importance, that is, subcutaneous injections are widely used for administrating medications like insulin, low molecular heparin, certain vaccines, various palliative care medications, making this technique essential in many clinical settings, right? Equipment preparation, gather syringe, needle, medication, alcohol swab, gauze, and a sharps bin, right? Medication check, verify medication name, expiry date, dose, preferably with a witness, right? Pre-procedure, confirm the patient's identity and check for allergies. Inspect and select an appropriate injection site. Describe the injection site, which would be upper abdomen, upper arm, thighs, buttocks, and the rationale for this site choice. So why do you choose these sites? Whenever, so let's look at the sites again. Abdomen, upper arm, thighs, buttocks. Like, what is the reason for these particulars? Anybody? Does anybody have any opinion? Any idea?
Because of the absorption.
Because of the absorption. What about the
I think it's
absorption?
because these sites have a lot of fat. They have a lot of subcutaneous fat.
Absolutely. The whole point is these are injections that are going into the subcutaneous space. So you're looking for areas where the subcutaneous fat is high, right? So this is like a slow modified release. It's not like an immediate uptake. So it gets absorbed in the fat and then it slowly keeps releasing these medications. Right. So first, when it comes to the skin layers, there is epidermis, dermis, then comes the subcutaneous layer, and then comes the muscle. So this is not intramuscular, this is not dermal or epidermal. This is subcutaneous. So after the dermis, so that is, you have to pierce through the epidermis, dermis, get to the subcutaneous layer. But if you go a little more deeper, it will go into the muscle. So you don't want to go into the muscle for this, right? All right. So yes, so the rationale for choosing this site, yeah. Clean the area, pinch the skin, inject at a 45 to 90 degree angle and apply gauze. Explain post-injection steps, withdraw needle, apply gauze gently, and safely discard sharps, right? That's also an important point. Discuss key precautions, avoid inflamed or scarred skin, rotate sites, maintain aseptic technique. So, Dr. Patience, you gave a good answer for the rotation of the site. That was good. So, could you just explain that again? Why would you rotate the sites of the injection?
Well, I said the reason is the quantity of fat does reduce if you have repeated injections in the same area. So with time it gets painful, I
Yeah,
think.
but why do you think so? So basically, you're injecting in the subcutaneous fat layer, right? So most of the times on doing that, there is a lot of destruction of the fat, right? So a repeated injection on the same sites can cause something called lipodystrophy. So it can cause hypertrophy or even sclerosis. Right. And that way, if there is such an active inflammation that is going on, an active trauma that is happening in that site, the absorption from that site will be relatively less, on subsequent injections to the same site. So that's why you keep rotating the site, letting that previous site heal a little. Do you understand? And that's also another precaution that you need to take when you are giving the subcutaneous injections. Make sure that there is no scars, no active inflammation or infection in those areas, right? So that
All
these
right.
medicines don't
Thank
get
you.
from absorption to get absorbed. All right. Discuss key precautions. Avoid inflamed, scarred, rotate areas, maintain aseptic techniques. Yes. Describe potential complications of poor site rotation, like lipodystrophy, and why they matter. Proactively offer your contact details for follow-up learning or to schedule another teaching session. Offer safety netting by reassuring the student that it's okay if all questions aren't addressed during the session, that you'll arrange another session just so you can do that, right? Offer the student relevant leaflets or direct them to trusted online resources, right, for further reading on subcutaneous injections. So as soon as you see that your 2-minute bell has gone off, try to incorporate these aspects, that we may not get enough time to, finish talking about this topic. So how about you take my number and we can arrange another session where we can, address any further doubts or, complete the topic. And also, I'd like to give you some resources that you can read up from, you know, uh, and which are from trusted NHS websites and indexed medical journals. Yeah. All right, interpersonal skill. Use simple language. Do not use any technical terms without explaining them. Yep. Encourage questions. Feel free to ask questions anytime. Be supportive. It's normal to feel a bit anxious about this procedure. I'm here to help. Use simple language to explain concepts. Actively listen and provide constructive feedback, right? Important is to check understanding. Obviously, if they make any mistakes, make sure you correct it, right? Suggest additional resources for further learning. All right.
Please like and subscribe to Turing Med School. Good luck with your preparation.